ESR's contribution to the COVID-19 pandemic response saw quite an increase in the value of our contract with the Ministry of Health. It was an additional $24 million per annum at the height of the pandemic. And that supported several key functions, including the wastewater testing that's been mentioned, rapidly scaling up our whole genome sequencing and enhanced surveillance. But as with most of the COVID-19 related funding, it was scheduled to finish in June last year. However, in budget 2024, there was $9 million of additional funding voted to the Ministry of Health to support continuing some of those key functions that I've just mentioned. Now, that's obviously less than the 24 million that it was during the surge of the pandemic, but to put this in perspective, the health funding pre-COVID-19 was about $17 million that we received, and so it's $9 million on top of that. So it's quite an increase in that capability and capacity. So saying, it did mean we needed to go through a structural change process because that $24 million had dropped to the $9 million. So we undertook that process late last year. There were around 40 redundancies through that process, but there are two key points I want to make here. First of all, our staff numbers are still over 20% higher than they were pre-COVID, partly because of that continuation of that funding for those functions. And also we've gained some additional research and service contracts during the 5-year period. The second point is, and this is an important one, the proportion of our funding that's spent on corporate related services is the same now as it was pre-pandemic, 23%. So we haven't had this surge in numbers in those support functions, and we've retained, so that increase in staff overall has meant we've retained the proportion and focused particularly on science and research.
First question from Honourable Benny Henry.
Thank you, Madam Chair. Thank you, team. Tēnā koutou. It's good to see you. Thank you for your opening remarks. I know one of the strategic intentions is around your partnerships with Māori, and given that that was for a certain period of time, my question is about the strength of that partnership and the relevancy of any of that work moving forward. The question is, context to that question is, it would be a shame to throw the baby out with the bathwater, if you will. So I'm just looking towards the value of that and whether or not it might be something that is worth continuing moving forward.
I'll make a couple of comments. Thanks for the question. Yes, this is an important element of our work. We, from our corporate overhead, we have established, as part of that, we've established a Māori impact team, and the way that team works is largely alongside our science teams. So we have a number of initiatives, in particular funded through our strategic science investment funding, where for example, our teams working in water or foodborne disease work with the Māori impact team, and specifically with Māori communities. Our intention is to continue to develop those partnerships, not as a good thing just in and of themselves, but what we're really focused on is on having impact for Māori communities as part of our impact for wider New Zealanders. So it remains part of our portfolio, and if anything, an intention to really refine that and ensure, yes, we've spent time and effort to develop the partnerships and the relationships, and now the opportunity really to leverage those to ensure we actually are delivering impact, not just the partnerships per se.
Supplementary, Madam Chair.
Supplementary.
Thank you, Madam Chair. Just to that end, you speak of the partnership, and as I read through the annual report, partnerships are a crucial part to what you do with your mahi, but also with respect to funding. In those attempts, have there been any significant partnerships drawn up with iwi, in particular post-settlement end?
Off the top of my head, I think they're all with different iwi around the country. We've certainly got 2 projects I know of here with Ngāti Toa. So I'd probably say there are 4 or 5 that are with iwi, different iwi around the country. And in fact, the conversation is usually with them about what are and they're very often environmental issues and the impact of the environment on the health of local hapu or iwi. And so that's where we've really focused, is on those iwi related partnerships. One of the areas we're interested in, of course, is the Māori economy as well, which is large and growing.
When it comes to your work on COVID and your ongoing work on COVID, how do you see this progressing, and what do you see kind of the outcomes to be? Do you see this long-term work on COVID, or do you see this as still as a temporary measure?
You may as well answer that.
There are two elements to this. One is, yes, it's important to make sure, to continue the surveillance of COVID at the moment. It's, not forgetting this is a novel disease. It's adding an additional impact onto the healthcare system. We've got the burden of long COVID that we're still just getting our heads around as well. So, the additional COVID burden in terms of morbidity, hospital admissions and deaths from infectious diseases is over and above that of flu. So the surveillance is important. And we also see the virus still changing. And whilst we haven't seen any major changes in that virus to new variants over the last couple of years, it is still changing quite rapidly. Most countries are still surveilling COVID. That's the first part of it. How long that will go for, I'm not sure, but it's the second part that's really important is the capabilities we've developed through the pandemic and using those capabilities to strengthen New Zealand's surveillance. It's pandemic preparedness in particular. We're all watching carefully what's happening with highly pathogenic avian influenza. And so the value of the COVID-related work is ensuring that we're refining our techniques, we've got the capability and capacity, and we're expanding the range of, for example, viruses that we might detect in wastewater, that we're staying at the cutting edge of whole genome sequencing and so on. And for example, we've got one of the initiatives that's funded through the TANIFA infectious disease platform, and we're working with Otago University on this, is the development of a portable genome sequencer that could be used if we get highly pathogenic avian influenza in our wildlife here, particularly from migrant birds, Canadian geese, for example. So we've got both the human health aspect of it, but also that broader One Health contribution that we can make.
I noticed that you mentioned you have a 20% increase in staff from pre-COVID. Is that mainly scientists working in the virology space, or is it across the board?
It's across the board. Definitely an increase in the staff in our labs, and the whole genome sequencing capability was part of that. Also part of our health security team is our data science, AI and analytics. So that's been expanded as well. And that's an area I think ESR could really add a lot more value in the future. Is we've got excellent data, we've got really good people, and I think we can really strengthen our intelligence reporting, the timeliness of that, and the visibility of that to the public. Our website's good, but I think it could be even better.
We have seen that the meth detection in wastewater has increased significantly in recent months. How much of that can be attributed to some of the factors that you mentioned about increase in staff and kind of staff being focused on different kind of technologies and technological development? Because it's important for us to understand if it was already there or if it is because we are detecting better now. So can you kind of provide us some insight into that?
So the detection of those drugs in wastewater, there's no doubt that the techniques are improving. However, that increase that we're seeing in certain regions or communities around the country is, I would interpret that as a real increase. It's very sensitive, the wastewater testing. It has to be to detect, they're very, very small quantities. I would say that's a really useful indicator of the extent of drug use in certain communities. And of course, then it's able to steer not just the police, but prevention initiatives and into those communities. So, that's one of the many areas that we provide support to both the police and the health system around preventing drug-related harm. It's a concern, and I think you've seen that concern.
So the year that is being reviewed here, 2023, 2024, has there been any change in the way the testing is done or the frequency of testing compared to previous years?
Can we come back to you on that?
Yeah, that would be really useful. Thank you so much.